speaker will be Dr. Bertha Madras.
Yes.
Professor?
Thank you very much for inviting me and providing this opportunity to testify. My testimony is based on 6 converging roles and responsibilities that I've had over the years with regard to being a basic scientist, and with regard to being a sole expert witness for the U.S. Department of Justice in descheduling marijuana, with regard to government service, both as Deputy Director for Demand Reduction in the White House Office of National Drug Control Policy, as well as serving on the President's Opioid Commission very recently. Let me state with conviction and knowledge, from my perspective, legalization of marijuana in Canada is poor public policy, poor public health policy, and poor public safety policy. Some of the statistics and data that we've heard thus far have alternative ways of looking at the data, as well as alternative sources of the information. What are the current goals, and what is actually the consequences? The commercialization of marijuana in states has led to a number of consequences, of which we're only beginning to develop some very meaningful data, because many of them have not accumulated adequate data over the past 2 to 5 years. Past month marijuana use continues to rise above the national average for youth aged 12 to 17 in Colorado, Washington, Oregon, Alaska, the District of Columbia. In Alaska, youth drug use is up 20% since before legalization. In Colorado, the most reliable number we have is the National Survey on Drug Use and Health, which showed that youth drug use has increased between 2006 and 2017. In Oregon, monthly use by youth is up since last year. In Washington, it is up as well. Some industry backers claim that loosening marijuana laws will decrease alcohol consumption among consumers, but that is not the case. So what is the reality? The reality is that some have claimed that consequences among youth will be less. The reality is that consequences are higher than in other states. There is increased toxicology reports from Colorado showing increased adolescent suicide victims testing positive for marijuana. School suspensions in Anchorage, Alaska have increased because of marijuana possession. They've increased 141%. In Colorado, about 50% of youth in outpatient substance use treatment are reportedly using diverted marijuana. Selling to minors is forbidden. What is the reality? In Washington State, a state of 424 violations amongst licensed marijuana businesses, 288 pertain to selling marijuana to minors. In Oregon, a random sampling of 66 licensed marijuana retailers found 16 of these businesses were selling marijuana to minors. And marijuana dispensary density is associated with increased use by minors. Social justice ills will be served by legalizing marijuana. The reality is the opposite. Minorities are being arrested more frequently because of the unfettered access to marijuana. Alcohol consumption will decrease. The reality is that amongst marijuana users it's increasing. Hospital and ER visits and Colorado calls to poison control centers have risen 210% between the 4-year averages before and after recreational marijuana. Washington State has seen a 70% increase in calls between the 3-year averages before and after legalization. Central Oregon hospitals saw nearly 2,000% increase in emergency room visits. The black market in Colorado, the confiscation of illegally produced marijuana is inordinately high. The black market showed an increase of 844% in marijuana seizures in the U.S. mail system since this the legalization movement. The crime rate in Colorado has increased 11 times faster than the rest of the nation since legalization. A study funded by NIH, the National Institutes of Health, showed that the density of marijuana dispensaries is linked to increased property crimes in the area. And I can go on and on. In the workplace, we're seeing a much higher testing of marijuana. This is amongst people in the workplace. The insurance claims have become a growing concern among companies that for that reason. The growing demand has made it very difficult to find employees that can pass a pre-employment drug test, and for safety, jobs with safety issues such as mining and construction and others. This has become a very significant problem. We can go on and on with impaired driving. The number of drivers in Colorado intoxicated involved in fatal crashes increased 88% between 2013 and 2015. Driving under the influence has also risen. In Washington State, experienced a doubling in drug driving fatalities in the years following legalization. And in Oregon, 50% of all drivers assessed by drug recognition experts tested positive. I won't get into any of the other details because of shortage of time, but I do think that we have to take into account the entire impact. These are only impact with regard to what has been looked at. There are many other consequences that have been alluded to by my other honorable speakers to the left of me that include psychosis, long-term psychosis that are dose dependent to some extent, the psychosis coming after the use of marijuana, many other factors that I think have tremendous impact on the future of youth in Canada. Since I was born in Canada, I was educated at McGill. I currently have a research project on marijuana with a Canadian scientist at the University of Toronto. I have a tremendous concern about my fellow Canadian citizens and my colleagues, because Canada still remains at very near and dear to me. Thank you.
Thank you. And finally, from the Oregon Cannabis Association, Amy Margoliso.
Thank you very much for having me here today. My name is Amy Margoliso, and I'm the Executive Director of the Oregon Cannabis Association. The Oregon Cannabis Association is Oregon's largest professional cannabis trade organization, and we represent the cannabis business community at the local, state, and federal level. I am also an attorney and have been helping cannabis clients on criminal, corporate, securities, and other transactional work both across the United States and globally, including a number of Canadian businesses, since 2002. I was asked to come today to speak about what we experienced in Oregon, although I think I was placed at the very end perhaps to provide some sort of data rebuttal. In Oregon, we've had a medical program since 1998. In 2005, our medical program was greatly expanded to look very much like it looks today. In 2013, the Oregon legislature passed a bill legalizing medical commercial dispensaries, and in 2014, Oregonians voted in favor of ballot measure 91, legalizing adult use cannabis in Oregon. Having participated in nearly every step of legalization, I've had a unique opportunity to witness our state's successes in regulating cannabis, and we have had mostly successes. Legalizing cannabis in Oregon has raised tax revenue, funded schools, mental health services, and created thousands of living wage jobs. In contrast, and contrary to the prior testifier, we have not seen an increase in youth consumption, and we anticipate seeing some of the other positive impacts that other states have seen, including reduced crime rates and turning the tide of the opioid epidemic. Oregon also took the unique step of allowing cannabis crimes to be eligible for expungement, reduce most cannabis crimes to violations, and reassess the criminal sanctions for serious public safety threats surrounding the processing of cannabis. The state of Oregon also allows home cultivation of up to 4 plants per household and has historically allowed for much larger scale home cultivation. Oregon has, since 1998, when our program first started, see no documentable impact on public health and safety as a result of home cultivation, including no perceptible increase in calls to poison control for consuming raw plant material. C45 focuses predominantly on reducing the risk of youth use in cannabis. We agree with the government's approach of keeping cannabis out of the hands of minors and are encouraged by these efforts. We have taken similar steps in states where adult use cannabis is permitted. Recently, the National Survey of Drug Use and Health found that in Colorado, teen use of cannabis dropped to its lowest rate since 2008 following the legalization of cannabis. We have seen that same data in every state that we have seen recreational cannabis. And when I present this with a PowerPoint, I have a graph of each and every state where the states have stayed either stagnant or have seen a reduced amount of consumption on behalf of youth. Colorado has had the most significant drop, but this study showed that nationally, adolescent use of cannabis dropped and no states have seen an increased use. With the emphasis on public health in C45, it's important to point out that following cannabis legalization in several U.S. states, alcohol sales in those states have dropped by 15%. It's relevant to point out the stark difference in substance dependence between cannabis and alcohol. More research must be done on this topic, but of those who consume cannabis, approximately 9% will become dependent, whereas the number for alcohol is approximately 16%. However, one of the greatest impacts of cannabis legalization is the opioid epidemic. The American Public Health Association conducted a study that was peer-reviewed and published in the American Journal of Public Health titled Recreational Cannabis Legalization and Opioid-Related Deaths in Colorado. The objective of this nonpartisan study was to examine the association between Colorado's legalization of recreational cannabis and opioid-related deaths. They used an interrupted time series design method in order to compare changes in both level and scope of deaths. They found that Colorado's legalization of recreational cannabis sales and use resulted in a 0.7 deaths per month reduction and a 6.5 decrease overall. In the United States, however, some of the most significant issues facing the legal cannabis industry could be solved by descheduling the drug and allowing for interstate commerce and federal trade. Although there have been very strong studies and research done that show the positive effects on both public health and protecting youth, until the drug, at least in the United States, is descheduled, our industry is faced with many of the issues that Canada can avoid by passing C45. As stated in the beginning, cannabis legalization has been mostly a success story for the states that have participated. While our organization recognizes the challenges and continues to work with our public health regulators and researchers to ensure safe consumption, youth use prevention, and preventing cannabis abuse, we believe that these concerns can be mitigated through education, packaging and labeling, regulation, and enforcement. Thank you, and I look forward to answering your questions.
Well, thank you very much, and thank you to all four of you for getting us off to a start as we battle the statistics and the different interpretations of them. Okay.